joining us. We're going to wait a little bit to give people a chance to log in, but we'll be starting shortly. If you have any problems with your hearing or seeing, please type in a question to the chat. Thank you very much. Okay, I think we're going to get started since we're going to start with some introductions, and we'll hopefully people have a chance to join before the main presentation start. Again, my name is Grace Meng. I'm a senior researcher in the U.S. program at Human Rights Watch. Thank you so much for joining us. It's really wonderful to see the interest in this issue. I'm going to start by introducing the presenters and explaining a little bit about the format of this webinar. You can see below in the handouts, we have a couple of handouts. We have the slideshows for two of the presenters, and we have the Human Rights Watch Civic report and the NOPE report on medical care and immigration detention, which you can also find online as well. There will be links available during the presentation. As I mentioned, I am Grace Meng, Senior Researcher in the U.S. program. I will be speaking first, doing a brief overview of the national landscape on immigration detention and medical care. And then Mr. Francisco, a client of NOPE's Health Justice Program, will be speaking. He was formerly detained in an ICE facility, and he will be speaking about his personal experience struggling to get adequate medical care while detained. We are withholding his real name to protect his privacy, and he won't be answering any questions about his case. But Laura Redmond, the next presenter, will be available to speak generally about NOPE's advocacy on his and other clients' behalf. Laura Redmond will be the next speaker, and she will be speaking about NOPE's Health Justice Program. She is the director of the Health Justice Program at New York Lawyers for Public Interest, where she leads NOPE's program challenging health disparities and systemic and institutional barriers to accessing quality health care. Before joining NOPE, Laura worked at the National Center for Law and Economic Justice, first as an Equal Justice Works Fellow, focused on access to Medicaid, and later as a senior attorney litigating federal and state class action cases seeking systemic reform in the public benefit system. Prior to NCLEJ, Laura was a senior legal officer at the Commission for Racial Equality in the United Kingdom and clerk to the U.S. Court of Appeals for the Second Circuit Staff Attorney's Office. Laura has a JD from Northeastern University School of Law and an MA in Gender Studies from Birkbeck College at the University of London. Our last speaker will be Christina Fiallo with Civic, and she is a co-founder and executive director of Community Initiatives for Visiting Immigrants in Confinement, a national nonprofit working to end the U.S. immigration detention system. Christina is an attorney, social justice activist, and the daughter and granddaughter of immigrants. She was awarded the 2016 Ashoka Fellowship and the 2012 Echoing Green Fellowship in recognition of her innovation and entrepreneurship on behalf of people in U.S. immigration detention. Christina serves on the board of directors for the American Civil Liberties Union of Southern California, and she is a social entrepreneur in residence at UC San Diego's Rady School of Management. Previously, Christina served on the steering committee of the Detention Watch Network for 6 years, was appointed to serve on the California Bar Association's Civil Justice Strategies Task Force, and was awarded the 2013 Rockwell Fellowship for a New California. After the presentation, we will have time for questions. Given the number of people who are attending, I'm going to ask people to type their questions. You can see on the little navigation panel, there is a place for questions, and if you type them in, you can type them as we speak, or you can wait until I open it up for questions, and then you'll be able, we will be reviewing the questions and asking the most common questions to our presenters. So thank you very much, and I'm going to start with Human Rights Watch's presentation. So in May of this year, Human Rights Watch and Civic released our report, Systemic Indifference, Dangerous and Substandard Medical Care in U.S. Immigration Detention. As many of you know, medical care and immigration detention has been a long-standing problem in the U.S. There have been numerous reports and investigations by journalists, by other nonprofit organizations, and yet there has not been a lot of effective reform and change. And obviously we're in a particularly challenging time with the Trump administration and their plans to increase deportation and detention of immigrants in the U.S. We worked on this report, and we really wanted to highlight the ways in which there was clear evidence of the kind of claims that immigrants have been making for years about the poor care in medical immigration detention. So we decided to focus very specifically on medical records. This is the scope of our investigation. We had interviews with more than 90 people, including people who were detained, family members, attorneys, and correctional health experts. But the heart of the report is really in the independent medical experts analyses. So we asked 2 independent medical experts, correctional health experts and doctors, to review 18 ICE detainee death investigations from 2012 to 2015, which were publicly released by ICE in June 2016. And then we also asked 2 experts to review 14 sets of medical records from individuals detained in 10 different public and private facilities around the country from 2015 to 2016. In 16 of the deaths, experts found evidence of dangerously substandard medical care. In 7 of these cases, they concluded such care contributed to the person's death. And so that's what we're really saying, is that those were preventable deaths. The experts found similar examples of dangerously substandard medical care in the records of individuals who had complained of bad care. So what are we talking about when we say bad care? Requests for care refused, ignored, or unreasonably delayed, including delays in emergency responses. Provision of care by unqualified medical staff. So there's many cases in which people were being given care by low-level licensed vocational nurses or licensed practical nurses, people who are not licensed. They are not supposed to be making diagnoses or providing treatment. They must be closely supervised by medical professionals such as physicians, but they were not being supervised adequately. Poor quality care by facility medical professionals, so that's doctors, nurse practitioners, physician's assistants who are technically licensed to provide the care that they did, but were not providing good care, who were making very obvious mistakes in the kinds of diagnoses and care they were providing. Delays in receiving off-site medical care, so when people need care that the facility itself cannot provide, such as surgery, there were numerous delays in getting permission to get that care. We saw severely inadequate mental health care, including misuse of isolation, which is a serious problem, and under international human rights law is actually considered torture when used on people who have serious mental health disabilities. And then we saw inadequate medical record keeping, which sounds innocuous, but we saw as really problematic because in at least 2 cases of people who developed cancer, it was very likely possible that the facility had made mistakes, had provided inadequate care leading up to the cancer diagnosis, and yet it was hard to determine whether the cancer could have been identified earlier because there was such poor record keeping. I want to highlight a couple of cases to just make clear how significant this impact was on people. Tiombe Carlos is a woman who died after committing suicide at York County Prison. She had been detained for 2.5 years. She had a history of mental health conditions. She had tried to commit suicide before, including once before at York County Prison, but facility staff failed to create a mental health treatment plan for her. There were repeated stays in solitary confinement in violation of ICE's own rules. As our Dr. Stern, one of our experts, said, staff were aware that this patient suffered from an acute and serious mental illness and was A, not getting treatment for it, and B, was not transferred to a facility that could provide that treatment. Instead, medical staff keep doing the same thing and expecting a different outcome. They keep giving her antipsychotic medication and no therapy, and she keeps trying to kill herself. Another example, Peter Rockwell. He was detained at Houston CDF, a private, run by a private company, Civic, formerly known as CCA, in February 2014. He had a history of high blood pressure and a family history of heart problems. He was supposed to get daily blood pressure checks and EKG. Staff did not provide those checks. They did not investigate complaints when he complained of blurred vision, which can be a symptom of a cranial bleed. When he finally collapsed 2 weeks after he entered the facility, the emergency team did not bring oxygen or other equipment. No one administered CPR, and it took 8 minutes before anyone called 911. There were actually other aspects of the ways in which his care was delayed. And ultimately, he died of a hemorrhage, which is a common complication of high blood pressure. One thing I really want to emphasize is that these facilities provide poor care, but there's also a serious failure on the part of ICE. Routine inspections that these facilities receive result in passing grades for these facilities, in which people die after inadequate medical care. So in several cases, we know that the facilities provided poor care. We know that our experts identified the poor care as a reason for these people's deaths, and yet the routine inspections that occurred before these people died said everything was just fine. And even when ICE is able to identify problems, as in the death investigations, they continue afterward. So our prime example is Eloy Detention Center in Arizona, which is pretty notorious. So 4 of the 18 deaths in our study were at Eloy, and Eloy has had more deaths than any other facility in the country. 3 of those 4 deaths were by suicide, and the lack of a suicide prevention plan was flagged in each one by the Office of Detention Oversight. An audit by a different ICE office prior to these deaths stated there was an appropriate policy and procedure for suicide intervention. So basically, these 2 different ICE agencies looked at the facility and came to completely different conclusions. The DHS Office of Civil Rights and Civil Liberties stated in its annual report to Congress that it sent ICE 49 recommendations to improve conditions at Eloy. They actually didn't name the facility, but it's obvious it's Eloy because they mentioned the number of deaths and when they occurred. ICE took 2 years to respond, and CRCL concluded that its response was inadequate to 30 recommendations. As Dr. Stern stated, we have a system that is broken for detainee healthcare, and adding more detainees to that system can only make it worse. I'm sure many of you on this webinar know that our opportunities to do effective advocacy with this administration are extremely limited, and that may be a positive exaggeration. From Human Rights Watch's perspective, what we are pushing for, given that our opportunities for substantive reform are so limited, is to really push on Congress to say that they should not fund his deportation machine, that they should not be giving Trump the number of detention beds that he wants. That this is not a system that can hold any more people. But given the part of the reason that we wanted to organize this webinar is because options on the federal level are so limited, and yet there have been really wonderful creative examples of advocacy on a local and regional level around the country. And this webinar is really meant to highlight some of these examples to provide real practical case studies that perhaps could be replicated in other parts of the country. And I also just wanted to flag something pretty small, but I think might also be something to keep in mind. When this report came out, we had an immigration attorney contact us. She was trying to get her pregnant client out of detention. And she told us that the options were not great given the person's history, but she was able to use our report as an exhibit, as evidence for the poor care that people receive in immigration detention. And she was actually able to get her client released on bond. And so even on a very individual case-by-case level, I hope that that our report can be useful, even if we're not able to make significant progress on the federal level. The full report can be found here. We also have a short video that we made. And then I have also provided a link to an op-ed that Christina Fiala and I wrote in USA Today following deaths that occurred even after our report was released. So thank you very much. I'm going to be changing the presenter, and Mr. Francisco will be speaking next.
Okay. My name is Francisco, and I'm gonna tell you about my experience, in Hausa County. I got a detention on March 24, 2015, and declaration officers go to my house to pick me up. I don't know, only he knocked the door, and by almost like by 4:30, 5 o'clock, I heard about it, the door is, somebody knocked the door, and I'm looking, and I see a couple of officers, behind the door. And I'm gonna answer, what looking for. He said, we're looking for somebody else. And I'm gonna answer, what's the person's name? But he not give me the name to the person, direct person he looking for. So, at least I opened the door a little bit and I talked to him, what the person you're looking for. He said, oh, we're looking somebody else, and the super he told me, the person living here. And I said, yes, well, what's the name the person looking for? He said, oh, what's your name? I said, my name is Miguel Almonte. Sorry about that, and I said, okay, fine, he said, you have ID? I said, yes. I said, how many member a person live in the house? I said, I live with like my brother, my mother, and another person. He said, yes. You have an ID? I said, yeah, I have an ID. He said, you can look at your ID? I said, fine. I look at my ID, I leave the door open a little bit, When I look at the ID, I'm gonna look at, I look it back, I see the mostly like by 6 or 7 cops inside my house. I say, what happened? What's going on? He said, oh, we're gonna talk to you about it. I say, yes. I say, um, oh, you have your ID? I say, look at my ID in there. I say, you fill it out something for, for citizen? I said, yes, I fill it out something for citizen. He said, you have your passport? I said, yeah, I have my passport. Yeah, your green card? I said, yeah, I got my green card. And he told me, um, you do you have anybody with you right now? I said, yeah, my mother, but I'm not gonna tell her. I'm not gonna tell her nothing else, about my mother because my mother, she's an old person. So and that day, it picked me up. I got arrested, March 24. And in Hausa County, I have a bad experience there. When I get it the first day, he checked me out and everything. I told her, about all my situation, about my have a problem with high blood pressure, and I have a surgery, I have a brain surgery. I tell her my whole history. So when I get in, the few days when I get in on the Hausa County, he gave me the medication, the medication, give me my same medication that when I drink it. The medication he gave it to me in there, that's generic medication, it's not be the same medication that doctor give it to me. Generic is gonna be, like a regular medication. So I see, couple of more days, I still, like my system, I don't feel good in there, I see my hands get swelling, uh, my leg get swelling, I got like a pain, on the right in my right side, but I said, what that pain is coming from, I'm trying to think about it, and I told one the one I be in there, one of my friends. I said, listen, I had to see the doctor, He said, oh, you have to see the doctor, you have to fill it out, like a res. No, it's like a something you type in the computer. But I'll be a person, I know you sell a computer, so my friend helping me out. So we put a request to see a doctor. So one day I feel it like a strong pain, and it called like the CEO wasn't that night there. He called, call white that's like me, 911. So when he call white, go pick me up, and he drive me to the room, for like the doctor room to see the doctor. But in the night, in the house of county, have doctor in there available. Only it's gonna be nurse, like a general nurse, So the lady he told me, what you feel the pain? I said my pain is gonna feel in my right side up in the level of my ribs. So she told me, you have constipated anything else? I said, no, I'm gonna go well to the bathroom. I don't have anything constipated. He said, oh, okay. Um, he put me in there for like about few minutes, One this year he told me, when I be in the room, the medical room, one this year he told me, when you feel the pain? I said, my pain's gonna be in that side. He said, oh, okay. The another nurse is calling me. He told me, when you feel your pain? I said, my pain I feel in the right side, up in the level of my rim. So she said, oh, I believe that's the gallbladder. I said, I don't know. I feel a strong pain, I don't know what's going on. The only he gave it to me that day, the first day, he gave it to me like a Malix. That's almost like a best of small, something like that. I'm drinking, the pains continue. She told me, how you feel? I said, I'm gonna feel the same pain. Oh, give it like a few more minutes, you're gonna feel better. Okay, you know, she said, oh, how you feel? I said, I'm gonna feel the same, the pain's not gonna wait. She said, oh, I'm gonna send it back to the facility, to your room, and I'm gonna make an appointment to you gonna see the doctor. I said, oh, okay. So he's gonna send to me, to send it back to my room. Boom. This happened, like few weeks past, I'll go to the doctor. I check me out with the doctor, The doctor, he told me he take a blowout, whatever, whatever. And the doctor said, I'm gonna put a request to ICE to do it like a ultrasound. Ultrasound, that's like me like a sonogram, to look at my gallbladder. He said we have to wait for ICE to approve it. It's gonna take a couple of weeks. I said, okay. The pain continue, for like no like the same day, but in different day, like a small level pain, but it's continue to pipe it, So one day I have another strong pain, and one of my friend he called the CEO. He said, "Listen, this guy he can't sleep last night. This guy got a strong pain, so I don't know." He said, "Okay." He called Y again. We call Y, and he give it to me like some kind of pill and injection. I don't know what kind the injection give it to me. The injection give it to me. The pain goes away. Okay, he sent it back to me by my facility, to my room, and and that day, one day he sent to me He said, Miguel Almonte. I said, yes. He said, the doctor want to see you. He do a sonogram, the ultrasound. The ultrasound, he found out I got a multiple stone, in my gallbladder. So he sent to me to the hospital, and a lot of things happening, and never do the surgery in there. The thing is, when I go, the ice it released to me. Um, I'll be in the house like one night to sleeping, and I feel a strong pain in the house. Strong pain. I know what will come my mother because my mother is old person. So I call like a taxi driver, and the taxi pick me up. He sent to me to the hospital. When I be in the hospital, he do the same ultrasound there. He found out multiple stones, and the doctor he told me, go to the room, and we see we're gonna do it. When I be in the room sitting there, I see two doctor. He called me, to come to me. He told me like, you have anybody else, member of your family when you're in here? I said, no, I come by myself. I said, you going yourself? You can tell me, everything happened. I told her, the whole story that when I talked to you about it, I've been in housing facility, in ICE facility. The whole story. He said, oh, I know where that is coming from now. And then he said, listen, right now you have immediately surgery. You can go to your house, call anybody member to your family and tell her come over here because your gallbladder is like infected. You have to take out your gallbladder. I said, what? I said, yes. So from that day on, I had my surgery. I feel good. I feel better. I don't have any problem in my past, in my present right now. And my life is living well right now. Thank God, whatever happened.
All right. Thank you. Thank you, Francisco. This is now Laura Redman from NILPI speaking, and I will try to move quickly through our presentation, some of which some of you might be familiar with or interested, have heard from, kind of repeating some of the horrible things that Grace said in her presentation as well. So again, I'm Laura Redman. I'm the director of the Health Justice Program at the New York Lawyers for the Public Interest. And we bring a racial and immigrant rights focus to healthcare advocacy in New York City and New York State. We work to eliminate health disparities, racial and ethnic discrimination, and systemic barriers. We promote immigrant and language access to healthcare, and also address the social determinants of health so that New Yorkers can live healthy lives. When we refer to our work relating to healthcare access and immigration detention facilities, we call it a human rights crisis because that's what it is. Each year, the federal government and its contractors detain thousands of New York City residents in ICE detention facilities throughout the New York metropolitan area. They contract with local county jails to house people while they await their immigration proceedings. I should clarify that our program focuses on people who are in removal proceedings and not people who are in detention because they are here seeking asylum or refugee status. Our goals in our program are to address the lack of adequate health care and discharge planning for people confined to immigration detention, to hold ICE and the county jails accountable for their failures, and really our overarching goal is to follow the successful path that's been forged by prisoners' rights advocates in the last few decades and use a multi-pronged approach of individual advocacy, impact litigation, and policy advocacy. For our individual advocacy, we use our established relationships with outside medical providers. We review individual situations and provide advocacy for individuals who are detained or released. Just one moment. We do advocacy for people who are both detained and requesting better care while they are detained, and we also support immigration attorneys who are making requests for release on bond or in underlying immigration cases. Our individual advocacy obviously informs our systemic work, and two highlights I'll talk about today are our federal court litigation filed in July 2016 and our report that we published in February 2017. So our systemic work. The first thing is this litigation. We filed in July 2016 Charles et al. Versus Orange County in the Southern District of New York. Our case alleges a violation of the U.S. Constitution regarding a county's failure to provide mental health discharge planning. We allege that Orange County provides mental health discharge planning for those that it criminally incarcerates, but not for those people who are confined to immigration detention. And how these jails work, for those of you who aren't familiar with these concepts, they usually have one wing of people who are criminally incarcerated and one wing for people who are in immigration detention. So our complaint alleges that mental health discharge planning is part of constitutionally adequate health care, or constitutionally required adequate health care, excuse me. Our case at the moment is before the judge on a motion to dismiss, a judgment on the pleadings, and we are awaiting that decision. Our other systemic work is about a report, and I'll move through this quickly because really what we found locally is very similar to what Grace mentioned before nationally. But just to give you background, between May 2015 and November 2016, we interviewed 47 people with serious health conditions who were currently or recently confined to the facilities, either Hudson County, Bergen County, or Orange County jails. Detained immigrants, as you likely know, face many barriers to accessing quality health care: lack of information, institutional disregard for their requests, lack of oversight, language access, and outright denial. One of the things we found quite regularly is people were denied treatment that they had been a kind of continuous course of treatment that they had been experiencing on the outside, and then that was cut off for them when they were detained. The detainees, the people confined to immigration detention that we worked with, predominantly people who are lawful permanent residents or predominantly green card holders who'd been here for many, many years. They often spend months, if not sometimes years, in detention. And people with serious illnesses are obviously particularly vulnerable when they're confined to immigration detention facilities because they require consistent and comprehensive care to manage their health. So again, through our report, we identify the following serious recurrent deficiencies, quite similar to what Grace said earlier, so I'll go through quickly. There were incomplete intake assessments, denial of continued treatment that was underway before admission, language access barriers, lengthy delays, denial of requests for specialized care, inadequate treatment for acute pain, failure to manage chronic illness, denial of exercise and nutrition, and lack of mental health discharge planning. So a few more stories to add to the parade of horribles here. We interviewed Mr. Sanchez, who's a limited English proficient, native Spanish speaker, and he was detained actually in all 3 facilities over the course of 3 years. He also suffers from suicidal thoughts, and despite the fact that he was limited English proficient, his monthly consultations with the psychiatrist were conducted in English. On rare occasions, a correctional officer would act as an interpreter, but obviously Mr. Sanchez felt uncomfortable sharing private information, and additionally he met with when he would met with the facility social worker, she would ask another detainee to interpret. A next story, which I think Mr. Ahmed's quote here really sums up the experience and the feeling of people who are in immigration detention. When I was detained, I thought that at some point I would be dead. They think we're animals and we just have to accept whatever they say. Mr. Ahmed had a pacemaker, and several times while he was feeling chronic symptoms, he would request to see a specialist. Both ICE and Hudson County repeatedly refused these requests. At one of his hearings, the immigration judge noticed that he looked so ill that he sent the paramedics to take him to the hospital, where they performed emergency surgery to replace his pacemaker battery. So it was not until then the immigration judge granted him bond that he was able to return to the community for ongoing care. So our report, not surprisingly, found that ICE and the New York City area facilities which contracts routinely deny vital medical treatment, such as dialysis, blood transfusion, to people with serious health conditions, subject sick people in need of surgery to unconscionable delays, ignore repeated complaints and requests for care, and refuse basic items such as glasses and dentures to people with medical conditions such as diabetes. So what are we doing about all of this, which, as Grace said, is part of the positive we want to put on today, and really call to all of you to take up these charges in your own communities. We've developed what we call a medical legal partnership here. As an overview, really, we receive referrals from immigration attorneys and community-based organizations whose clients have serious medical needs that are going unmet. We interview the client in the facility and determine the best course of advocacy, either in working with the attorney, either advocacy internally with ICE or with the immigration court. And then we connect with qualified doctors to perform outside evaluations on health conditions and current treatment regimens in support of the advocacy efforts. And we currently have a network of about 40 providers. So again, just kind of the individual steps of our advocacy program. We get the referral, we do an intake, usually a visit with the client alongside the immigration attorney. At that time, we have the person sign a limited engagement letter and a HIPAA request if we're going to proceed. That allows us to request medical records and also to connect back with them without always having to go through the immigration attorney. So we request medical records, we connect with the provider reviews the records, and then we either write an advocacy letter to the deportation officer, field office, or the immigration judge along with a letter from the provider. So just a few kind of tips that for people who are thinking of doing this type of advocacy, and I'd be happy to answer any questions, of course, on this. But for the medical providers, a few things to keep in mind. This type of work we found really doesn't require a visit to the detention facility. In fact, it's quite challenging. I know in some other contexts, like in the asylum context, that's really a part of it, but the majority of the work for our network so far has been reviewing medical records and applying that knowledge, and that's found that we kind of get a greater number of volunteers. After the reviews, our volunteers write an evaluation of the case in letter format to support the advocacy, and this summer we'll be doing a writing workshop for our network volunteers to just kind of bring forward the idea of how to write these letters and reviews. For legal providers, a few things to keep in mind on your side of this partnership. People confined to immigration detention have a right to adequate health care under the Fifth Amendment Due Process Clause as civil detainees, Estelle v. Gamble, U.S. Supreme Court case in 1976. There are obviously different standards and different circuits that must be met, but in general, civil detainees should be treated as well as, if not better, than those who are criminally incarcerated. Case law regarding the civil detainee population is quite limited, but cases have been brought based on different types of illnesses and harm, so of course we would recommend research on the particular issue that your client is experiencing. Just a few other kind of small tips. Again, things you may know, but just to raise them here. The personnel at the county jails and with ICE and the ICE liaisons do change quite frequently, and we found that those relationships are really important in having our advocacy actually lead to better care. As well, access into the facilities, into the jails to talk to people is certainly eased by a legal representation relationship, which is why we do that limited engagement letter pretty quickly. So my closing story is kind of try to bring this together, the horribles of what's going on, what we're trying to do about it, and where in the few cases where we are actually able to make a difference. So this is a story about actually 3 different people with diabetes for whom we provided advocacy. A consulting board-certified endocrinologist who is part of our network evaluated their medical records. This physician found that under the current regime overseen by ICE, all 3 people were at risk of infections and diabetic complications such as retinopathy, renal failure, heart attacks, or strokes, even while they were on their insulin regimen. Hudson County, for these folks, had only provided them with a diet full of complex carbohydrates, and ICE had refused to provide dentures for 2 of the people who, because of their diabetes, were suffering from gum disease and losing their teeth, and another one of these individuals reported rashes all over his body and pain in his leg and foot region that, if left untreated, could have resulted in amputation. So a success here was when all 3 of these individuals, separately obviously, went before an immigration judge for a bond hearing. They were granted bond, releasing all 3 into custody, from custody, based on the evidence of inadequate health care that NILPI had provided, including this very specific letter from an endocrinologist. So it really made a difference in this case, and the immigration judge was able to see both what the health care that they weren't receiving and what those real complications and the consequences of that could be, and all 3 people were given release on bond. So that's really an outline of our program and our medical, legal, and community partnership here. If you have any questions, obviously, hopefully there'll be some time here, but I'm also happy, please take down my email. This is also a link to our report, which again, as I noted, find similar conclusions from the Human Rights Watch report, although it is focused particularly on our work in these 3 facilities, which are county jails that contract with ICE to confine people while they are in removal proceedings and awaiting their immigration hearings. So thank you for listening today, and I really hope people can see this and move in your communities in your parts of the country to really expand these kinds of networks. Thanks.
Thank you so much, Laura. All right, I'm going to now change the presenter to Christina Fiallo.
Great. Thank you so much for joining today's webinar, everyone. So I want to take the next 10 to 15 minutes just to provide a brief overview of Civic's work and discuss the power of data collection and storytelling, and then provide a brief introduction into some of the independent monitoring tactics we use to provide direct support to people in immigration detention who've been abused, and also lift up widespread issues for local and statewide policy change efforts. So my organization, Civic, which stands for Community Initiatives for Visiting Immigrants in Confinement, is the National Immigration Detention Visitation Network. And our mission is to end U.S. immigration detention. We visit and monitor 43 of the largest immigration detention facilities, as highlighted on this map with the tiny purple hands. And we run a national hotline that allows people in all 200+ detention facilities to call us at no cost to them. And it's really through these 2 windows into the detention system that we track human and civil rights violations. And then we use the data and stories to educate municipal, state, and federal legislators on how our tax dollars are funding a system that perpetrates human and civil rights violations, such as medical neglect in immigration detention. So why visitation? Well, we believe that the immigration detention system really thrives on a culture of secrecy and censorship, compounded by the trauma inflicted upon communities who fear retaliation for speaking out against the system's abuses. So Civic's affiliated visitor volunteers soften the psychological impact of confinement by boosting morale through weekly visits, one-on-one with people in immigration detention. And visitor volunteers also help people in immigration detention connect to their family, and often are involved in leading public campaigns for release. And as you know, many detention facilities provide deplorable conditions and insufficient medical care. So while Civic's ultimate goal is to end immigration detention, we believe that we have to provide care and support to people in immigration detention right now. And while we provide this care, our visitor volunteers can serve as the eyes and ears of the detention system to track rights violations with our friends in detention. So that brings me to my 4th slide here, why independent monitoring? Well, we believe that if Congress and the public truly knew that our tax dollars were being used to perpetrate human and civil rights abuses on such a grand scale, then this would pave a way for a true conversation on community-based alternatives to detention. Maybe not right now under this administration, but definitely in the future. So the current model of immigration detention oversight by the government does not effectively address or prevent human and civil rights abuses. Only ICE and its umbrella agency, DHS, conducts audits of immigration detention facilities. And as there's no independent oversight, there are untold and unreported abuses. When abuse is reported, it's rarely investigated. For example, we filed earlier this year a complaint on behalf of 27 people in 15 different immigration detention facilities regarding sexual assault. And we also analyzed data we received from the Office of the Inspector General through a Freedom of Information Act request. And we found that between January 2010 and July 2016, the Office of the Inspector General received over 33,000 complaints of sexual assault or physical abuse against DHS component agencies, but the Inspector General investigated less than 1% of these cases. So just briefly here, more of the complaints were submitted against ICE than any other DHS component agency. Of the total number of complaints, over 44%, or nearly 15,000 complaints, were lodged against ICE. And although sexual assaults are being perpetrated by ICE officers, contracted facility guards, and even medical professionals, Congress and the public are largely unaware of this extremely low rate of investigations. So this is why organizations like Civic that have a consistent presence inside these facilities must be tracking this abuse. Through our visitation programs and hotline, we receive hundreds, sometimes thousands of complaints per month. The top complaint we receive nationally is around medical care, which is why we wanted to partner with Human Rights Watch on this report. So how do we address this abuse? Well, for medical care and in severe individual cases, we found that filing a complaint with the Office for Civil Rights and Civil Liberties and marking that complaint as an emergency does sometimes result in immediate care. For more minor medical issues, if we have a good relationship with the local field office or the jail, sometimes raising the issues directly with those at the facility can be effective. However, what we have found particularly effective on many levels is filing multi-individual civil rights complaints with the Office for Civil Rights and Civil Liberties, which is a division within DHS. And we usually file these complaints in partnership with people in immigration detention. And this work really builds upon our inside-outside strategy, which is at the heart of all our organizing work. And what's great about this particular strategy is you don't have to be an attorney to undertake this type of advocacy or to file a civil rights complaint with the Office for Civil Rights and Civil Liberties. So why do we file these complaints? Well, CRCL as an agency, as some of you may know, is pretty ineffective and not fast at responding to non-emergency complaints. However, what we've done is we've used the complaint to highlight widespread abuse issues, and we also engage the media whenever we file this complaint, which often gets both the local ICE field office and ICE National, as well as the facility, really eager to address the issue. It also often raises awareness with legislators, both at the state level, but also nationally, about what's happening inside of particular detention facilities that we find problematic. And with each complaint we filed, we've gotten a really positive result. So for example, through a combination of interviews and public record request data analysis, we filed a complaint on behalf of 61 individuals who were detained at the Hudson County Correctional Facility in 2016. And our ultimate goal was actually to get the county to appoint an independent monitoring board comprised of advocates and other stakeholders to pilot this kind of format of independent monitoring. So we filed this complaint in partnership with our affiliated visitation program there in New York called First Friends of New Jersey and New York. And through a combination of their visits and our hotline calls, we tracked medical abuse at this facility over a period of multiple years. But we began to see a significant increase in complaints in early 2016. So we did a tour of the facility through ICE's stakeholder tour process, and we were able to actually see some of the issues the women and men had noted, such as bacteria growing in the showers that was causing a toenail fungus outbreak at Hudson. And we documented cases such as an elderly woman who had lost much of her eyesight while she was detained, yet she'd received no eye or vision examinations. We also documented the case of Mr. Ahmed, who Laura mentioned, who was the man who had a pacemaker that ultimately had to be rushed to the hospital during one of his court hearings due to these issues that were going unaddressed. And when we filed the complaint, we also pushed the complaint out to media. So Nina Bernstein, who was still at the New York Times when we filed this complaint, did a rather in-depth article on our complaint highlighting the case of a man in our complaint, Nelson Fernandez, who had to be taken to the hospital on multiple occasions from Hudson. And in addition to filing the complaint and getting these stories and data directly from people in detention, we also file public record requests, either Freedom of Information Act requests at the federal level or open record requests at the state level. And this is really always helpful to give the complaint a strong media hook, but also to back up what we're seeing on a local level with some data from the government. So for example, through our open record request through Hudson County, we learned that 121 individuals under ICE custody submitted medical grievances at Hudson from January 2014 to May 2016. We also learned that Hudson only took corrective action in less than 3% of these complaints, which sounds very familiar to what is happening at the federal level with the Office of the Inspector General. We also found that 560 people, including many of the people in our complaint, were transported to an outside hospital, and that 33% of these individuals were hospitalized due to an unaddressed medical issue. We also timed the release of the complaint with an upcoming county meeting in which the medical provider at Hudson's contract was up for renewal. So the community came out to that meeting to highlight our complaint and highlight the issues within the Hudson detention facility. And I think that combined with the New York Times piece was enough to really make Hudson County take our complaint seriously. So Hudson actually ended up appointing a commission of 2 lawyers and 2 doctors to investigate our complaint and issue its own report. And after that report was released, the county issued a resolution to create the first medical oversight committee. And our visitor volunteers had a seat at that table for this committee. Ultimately, you know, the end to the story is bittersweet. We've been piloting this committee with Hudson, and what we've concluded is that it's pretty ineffective. As you all know, there was a recent death at Hudson, and I'll just point out here that we have a map on our website, which I'm pulling up right here, that we released through the joint report with Human Rights Watch, that you can click on it and learn more about each individual death that's taken place since 2003 in immigration detention facilities across the country. So in response to this death at Hudson, yesterday, First Friends, along with the New Jersey Alliance for Immigrant Justice, held a protest calling for a true independent oversight committee to oversee conditions at Hudson and the things that are going on a daily basis inside this facility. So what we've learned through this process is that, you know, for an independent oversight committee to be effective, it either needs to be non-governmental, so something similar to a network of visitation programs like Civic, or be housed with a government agency with no vested financial interest in immigration detention. This is what we suspected from the outgo, but we wanted to try to see what possibilities there were working at the local level. So this brings me to California. So Civic is based in California, and we have a growing presence in all 9 immigration detention facilities. The largest is the Adelanto Detention Facility run by Geo Group, and we've been documenting medical abuse at this facility since 2012. And we've engaged Congress on multiple occasions to help us highlight abuse at Adelanto. And this monitoring, combined with a massive hunger strike in 2015, really got our state legislators interested in immigration detention. So in 2016, we introduced what's called the Knee Not Detention Act, and it actually passed the state legislature but was vetoed by the governor. The act would have done 2 things. One, it would have ended for-profit immigration detention contracting in California, and it would have codified ICE's performance-based national detention standards into California law. We've reintroduced the bill again this year as SB 29. It's passed the Senate. It is at the Assembly right now, and we believe that if it gets to the governor's desk, we have a really good shot of him signing it this year. But what was great about that experience last year running this bill is that we had the opportunity to really sit down and educate legislators, not just on why this bill is important, but more holistically on the problems of immigration detention. And about a week and a half ago, through our state budget, we actually passed something that is really amazing. It actually put the budget bill put a moratorium on immigration detention expansion in California for 10 years, and it also awarded the Attorney General $1 million per year to do monitoring of immigration detention conditions. So what given what we've learned through our experience in Hudson County with the Medical Oversight Committee, we're using that combined with the knowledge that we've gained from monitoring detention facilities across the country to work with our state attorney general to develop a program that's really effective at monitoring detention facilities in the state of California. And the fact that there's actual money behind this, the Attorney General is going to be hiring a team of attorneys to really investigate abuse in these private and public immigration detention facilities. So, you know, Civic is here to support you all in anything that you may want to be doing in respect to independent monitoring. So if you're working with a client in detention or someone you know in detention who's been the subject of abuse, we can help you to develop a plan to address the needs of the person, to document a pattern or practice at the facility for this type of abuse, to file public record requests, to file civil rights complaints, and then to engage elected officials and the media. So feel free to be in touch with me directly. Our website is endisolation.org, and my email is here, and I'm happy to answer any questions as well. Thank you.
Thank you so much, Christina. Thank you so much to all the presenters, to Laura, Mr. Francisco, and Christina. That was incredibly informative, and I really appreciate the positive outlook. You know, I think so many times we deal with such really terrible outcomes and situations for the immigrants that we advocate on behalf of, and it's really encouraging and inspiring to hear about really positive efforts that are being made on their behalf. We don't have a ton of time left for questions, but I hope that the presenters who are able to stick around a little bit can stick around as much as they can for questions. If anyone has any questions, please go ahead and type that question in to the bar that says questions. I actually wanted to just start with a couple of questions. Yes, we have one question about the PowerPoints. The PowerPoints are on the handouts. If you go to handouts under sharing, I think the Human Rights Watch and NOPI handouts webinar presentations are available, and I'm sure Christina can send me her PowerPoint, and I can send that to everyone who registered as well. One question I have for you, Laura. How did you build your network of medical providers?
Sure. Well, we were quite fortunate in that we came into this work partnering with the New York Immigrant Family Unity Project, which is a kind of city-funded legal defense service for people who are in immigration detention. And they had some established relationships with just kind of one or two doctors. And so kind of had started kind of talking to those doctors who were obviously very overburdened with all of the cases there could be. And so we kind of asked and said, you know, what can we do? How can we help? And we, last summer, we held a convening and invited those individuals and asked them to really invite their friends and other colleagues. And so we held a convening last summer of about 50 or 60 individuals. Still majority were lawyers at that time, but it piqued the interest of a few other medical providers. One of the medical, sorry, there's a siren going by. One of the residency programs here in New York City has a social justice medical program. So we really tapped into some folks there, and they started talking to colleagues. And so from that convening, we were able to expand out. You know, there were still only about 5 or 6 folks. They started doing a few reviews, and you know, I think had a positive experience, if you can say that. And then our community organizer just really started hitting the street. She's been doing outreach with other organizations that those individual doctors belong to, other advocacy organizations that are made up of some medical providers and others not. And she's been doing presentations similar to kind of what I said to all of you today to try to kind of encourage and recruit folks. And there's just really, you know, I think particularly because of what's been happening on a national level and what people have been hearing in the press, there's been a real interest in kind of what can I do to help. And so we started with these kind of 2 folks who'd been taking the burden of a lot of it, expanded a little bit, then reached out through their communities and really targeted medical schools and organizations that had a social justice focus, and we've really had an overwhelming response. And you know, as I said, our network now stands at 40, and I'm sure it will keep growing.
That's amazing. And I can imagine the number of doctors who really just want to do something about immigration, and this is a great way for them to contribute.
Exactly, yes.
So we are pretty much out of time, but I did want to ask one question of Christina as well. Christina, you had mentioned, you know, that the Hudson County outcome had been disappointing, but I still find it really interesting that you were even able to persuade them to set up the advisory board, given Hudson County's sort of fiscal interest in immigration detention. I think a lot of journalists, I'm sure you've had this experience, you know, they stay focused on the private prison companies and don't realize how much counties also gain revenue from immigration detention. How have you been able to, in Hudson County and in other places where you've done localized advocacy, persuaded these areas that do get revenue that is in their interest to think about the welfare of the immigrants that are being detained?
Yes, so what we've found is that the conversation usually starts with the local county or city once there is kind of a light shined on them. So that's why we always pair our civil rights complaints with a larger media strategy, because I think if we just had filed the civil rights complaint, even though it was on behalf of, you know, a large number of people, 61 individuals, without having kind of that New York Times piece and a number of other local media pieces on the Hudson County Correctional Facility, they would have not felt the same type of incentive to actually address the issue, because, you know, reporters were asking them, what are you going to do? What are you going to do? So that kind of allowed us to get the conversation started, and that's what we found in other places that we've done this kind of civil rights complaint. So, for example, our civil rights complaint on medical care in Adelanto was really geared at trying to obviously shut down the detention facility, but ultimately a smaller win is we didn't want the transgender immigrants who were at the time detained at the Santa Ana City Jail to be transferred to Adelanto, which was something that ICE was planning to do and already made a public statement about. And so by engaging Congress and the media to shine a light on just how awful medical care was at this facility, it stopped the decision of ICE to transfer transgender women there. And actually, it also resulted in an investigation by the Office of the Inspector General and the Civil Rights Division at DHS that resulted in a change in the medical provider at the Adelanto detention facility. So I guess the short answer to this is that media really is a key to getting the conversation started and to allowing us to have kind of an upper hand in this kind of power dynamic that's at play between advocates and those who are in power overseeing these contracts between themselves and ICE.
That's really good to hear that it is possible, and also great to hear that Civic is available to help people think about media strategy. I think that's something that people can often feel like they don't really know where to begin. We have a question about, you know, asking how to help a specific person with cognitive impairment get out of immigration detention. I'm not sure where this person is located, but Christina and Laura, if you just want to sort of reiterate sort of what resources you have available.
Yes, sorry, this is Laura. So I'm not sure exactly if it's an actual request for assistance or just in general, but in general to speak, you know, as I mentioned in my presentation, we have had some success with helping immigration attorneys with bond and release requests based on the healthcare. There's obviously lots of individualized issues that go into that, but having a, you know, certified medical doctor be able to talk about the the dangers and the consequences of the person continuing to be detained, and making the point that they could receive the care that they need in the community. And certainly using, you're welcome to use our report, and as Grace mentioned earlier, if you are looking for a specific referral and are outside the New York City area, we're working on it, but at this point we're still pretty local focused. So I'm not sure which way that went, but that would be, in general, that kind of partnership, and certainly, making as broad a claim as possible has been successful in some of our cases.
And this is Christina Fialo. In terms of getting someone released from detention, I mean, there's lots of different ways that could be possible depending on the person's legal case. But in terms of campaigns to get people released, it really does depend on the field office. And for example, we've been really successful in Northern California in doing kind of behind the scenes campaigns, so ones that aren't public, but we put pressure on the field office to release somebody with kind of the knowledge that if they aren't released, then we are going to go public, particularly if that person has been abused. And we've been successful in getting people released within like 24, 48 hours with that strategy, but that strategy doesn't necessarily work, for example, in somewhere like Etowah, Alabama. So really thinking about the location and kind of the different tactics that are at play. And Civic would be happy to help kind of brainstorm that with whoever answered this or asked this question.
Right. Thank you so much. I think it is really interesting to hear how both of you have emphasized personal relationships with local personnel and how important that is. And I think it's really great that you're available as resources for people who are trying to think this through. There's just one last question. There's a question about whether NILPI, and I assume Civic also, has had any contact with consulates in their advocacy.
Sorry, this is Laura responding. We have not in our advocacy in this vein. I don't know in terms of the kind of release and such whether that may be something that the immigration attorneys are doing, but in terms of our actual advocacy for better health care, for adequate health care for people who are currently detained, we have not pulled in the consulates, although we are trying to expand the kind of community side of our medical legal partnership, and consulates are certainly on that list, but as of yet we have not.
Okay. And this is Christina. We have, to some degree, when we did a lot of advocacy around medical care for transgender immigrants, particularly those who were detained at the Santa Ana City Jail, and the Mexican consulate there in Santa Ana was really helpful in kind of reinforcing what we were saying publicly and in complaints, reinforcing that kind of behind the scenes with their contact at ICE. And so that was really helpful in getting a lot of issues addressed that were going unaddressed, that were individual in nature.
Well, thank you very much to all our presenters. Thank you all of you for joining us. We will be providing a recording to those who are interested. It should go out automatically to everyone who registered but was unable to attend. If you know anyone who is interested and didn't register, just please have them contact me. My email address should be on the webinar link. It is mengg@hrw.org, and we'd be happy to send the recording to them. Also, please note the contact information for Christina and Laura, who are happy to answer any questions as well. Thank you again, and looking forward to continuing this advocacy together. Thank you very much.